I know at some point in time we've all witnessed some kind of minor or horrific accident that we felt clueless or helpless with, that gave us a feeling that we wanted to help them. And that moment never leaves you. When I was a little girl, I'll never forget when my father took me over to my best friend Sunny's house because they'd just gotten a rainbow parrot. And he was about a foot tall. Sanborn, my best friend's father, brought us in to introduce us to the bird. We started talking to the bird, and he offered to pet the bird. So of course we engaged in him petting the bird, and so he went in, stuck his fingers in. He was happily petting the bird for about 30 seconds, and then all of a sudden, snap your fingers, the bird went and bit his finger. I'll never forget the scream he yelped and the blood dripping on the ground, seeing his face in distress. That moment never left me. I wanted to help him stop bleeding and screaming, but I was so small and I was so helpless. That's the first time I remember taking a vow to grow up to be a heroine scrubs, just like my father. So here I'm here to demonstrate how to clean and dress a minor wound. After demonstrating how to perform my basic wound care today, I am convinced that you'll be able to take your skills and put them to the test. And as a nursing student who values and knows the importance of patient care, as well as growing up watching my father be a nurse, I can assure you that these simple steps are just what you need to take with you if you ever come in contact with someone in an accident. So first, I am going to show you how to assess your wound, how to clean your wound, and how to dress or bandage your wound. First, you need to collect your supplies, which I've already done. You can grab a first aid kit at any grocery store or drugstore. You need your saline, which is basically just bottled water. You need gauze. You need some Neosporin, as well as a Band-Aid to fit the size of the cut. And Annabelle has a small abrasion on her leg, which is a small surface cut like you would happen with a knife. The second thing you need to do is wash your hands for 20 seconds with soap or hand sanitizer, which I have already done. The CDC states that it is imperative to wash your hands thoroughly to prevent bacterial buildup on surfaces of your hands to prevent infection on patient contact. First, you want to make your patient aware that you are going to dress and clean their wound, and it may cause some discomfort. Then you want to look at the wound to check the severity of the wound, which looks like it's a surface abrasion, like I said, a minor surface wound. The CDC also recommends that you thoroughly need to inspect the injury and take these certain steps to cleaning out a wound. Once you have assessed the patient's wound and gathered supplies, you want to move on to cleaning out the wound. So the second step is to clean the wound. You want to gently flood the wound with either your saline or your bottled water to clear up the blood. And it looks like it came off pretty easily. After you've cleaned off the wound with your gauze, you want to grab another piece to ensure it is nice and dry for applying the Band-Aid on. Now that the wound is nice and clean and free of debris, it's time to dress the injury to prevent any infection. So the final step to basic wound care is to apply antibiotic ointment and dress the wound from the following steps of the Gunderson Health System. First, apply a thin layer of antibiotic ointment to the wound. Then you want to clean any excess antibiotic cream that may prevent the Band-Aid from sticking. Then you want to grab your Band-Aid and carefully take it out of the package, and you want to avoid touching the middle part of the Band-Aid that comes in contact with the wound. You want to gently apply the Band-Aid and ensure that it is correctly adhesed to the leg to prevent any air from entering it, and also bacteria. Now that you know how to care for a basic wound, let's reiterate what I demonstrated and told you today. So today I presented 3 simple steps. I demonstrated how to assess the wound, I demonstrated how to clean a wound, and I demonstrated how to dress a wound. Today we dressed a minor wound, and I'm convinced anyone who watches these simple steps are able to apply them to your new life skills. Supplies are easily accessible at everyday stores, and every day we come across and stumble across someone with a helping hand. So when caring for someone with a minor wound, you just want to take caution that they do feel everything you're doing and they want to know everything you're doing. And again, I'm confident that you'll take your newly acquired skills and dress your wound perfectly. And please remember to leave the dressing on for 24 hours, and then you can re-inspect the wound to see if you need to re-dress the wound again. Thank you.